Hello, it's George at RD Physio. So today I wanted to talk a little bit about a type of injury called a repetitive strain injury, and how often when we see these in clinic, you find that if we potentially had an appointment a few weeks earlier, that the process may have been a little bit simpler. Often when we have somebody booked in, you find that you can categorise them into one of two types of patient. You have your more traumatic type injuries. Now this might be something that happens in sport where there is a clear and obvious cause of the problem and you know that you've injured yourself from that point onwards. But the second type of injury is a repetitive strain or a gradual onset problem. Now these tend to be a little bit more gradual in their build-up, and they tend to start off quite minor and easy to ignore, and often they do. They tend to be associated with an increase in our activity levels, whether this be a new running program, some more days in the gym, or picking up a new sport or hobby. Because these start off minor and easy to ignore, often is the case that we do, and we continue to push, and we continue to just carry on with these problems. But the issue is that if we ignore them over time, they have a tendency of getting worse. And so they begin to affect more and more of our lives, and it becomes not just the sport that's the problem, but it may be going up and down the stairs or getting in and out of your car, or those first few steps in the morning. And so it's at this point usually that we come in and seek help and advice. But as the problem's gone on for longer, potentially several months, you find that the road to recovery correspondingly gets longer as well. And so at this point, the rehab journey just takes that little bit of extra time. So some examples of these might be some things that you've heard of, like runner's knee, jumper's knee, otherwise known as patellar tendinopathy. These might be things like plantar heel pain or plantar fasciitis, or Achilles tendon pain, just to name a few. So when should you come in? My advice would be, if you've had an ongoing niggle that has not gone away for a few weeks, you've tried resting it yourself and nothing's really changing, then it's probably a good idea to come in and seek some professional advice.
Hi, I'm Roger. Thanks for watching the video. Hope you enjoyed it. And don't forget to hit the like and subscribe buttons.